Mr. President, I rise today to urge my colleagues from both sides of the aisle to support this veterans COVID-19 relief package to do right by the millions of veterans across our country struggling with this pandemic. For months, I have been hearing from folks back home in Montana on the need for Congress to put together a smart, targeted package that will quickly provide communities across the country with the resources they need to weather this storm. This includes delivering assistance and vaccines to those who have worn the uniform and sacrificed for our liberties. If this year has taught us anything, it is that we need to secure additional resources to expand medical services, mental health care, and telehealth capabilities to protect and support our most vulnerable populations. And we need a distribution plan that'll provide more predictability when it comes to administering vaccines. That way, we can get more vaccines into the veterans' arms as quickly as possible. So today we're putting a bicameral proposal on the table that delivers tangible relief to veterans and their families and to all Americans who need it. As we all know, proposals are rarely ever perfect, and this package is no different. But the truth is, we have good provisions in this bill that allow us to provide serious relief to those who swore an oath to protect our country. It will slow the spread of the virus, and it will help save lives. A previous package that was put forth by my Republican colleagues, I would say thank you for doing that. But unfortunately, that package didn't put as much as a dime to support our veterans and families. Now, there are a lot of things we disagree upon in this body, but delivering for our nation's veterans should never be one of them. That's why my colleagues and I worked with the Biden administration on this new relief package that allocates $17 billion in critical resources and assistance to the men and women who have served this country. The truth is that out of almost 7 million veterans that the VA serves nationwide, only 638,000 veterans have been vaccinated so far. And serious efforts need to be made to reach more veterans, especially those veterans who live in rural and frontier areas. Additional funding under our proposal allows the VA to increase vaccine distribution and outreach efforts to remote areas, including all veterans who want a vaccine can receive one. It even goes a step further in accelerating the deployment of VA's supply chain modernization initiative to improve the department's preparedness and response to public health emergencies. And it takes an aggressive approach in assisting vulnerable veterans by providing mental health care options, medical equipment, and additional services to women vets, those at risk of homelessness, and those who face unemployment. Now, make no mistake, this pandemic is taking a dangerous toll on our veterans. Veterans are experiencing job losses at unprecedented rates. The veteran unemployment rate for December was roughly double what it was this time last year, up from 2.8% to 5.3%. And with older veterans continuing to face more difficulty in the job market, it makes this package even more necessary today. Our proposal helps tackle veteran unemployment by establishing a VA Rapid Retraining Assistance Program that will strengthen existing job opportunities and establish new resources to get veterans employed and back on their feet. And for folks burdened by health care costs, our provisions waive co-payment billing and debt collection, as well as costs for COVID-19 testing, treatment, and vaccination services, because no veteran should have to worry about choosing between accessing essential health care and providing for their family during a global pandemic and an economic crisis. When veterans elect officials to Congress, they do so with the expectation that they will get the job done. So while this proposal is not a silver bullet, it is our best shot, however, at getting more folks vaccinated and our economy back on track. There should be no excuses. Veterans and all Americans are looking at us to do the right thing. We do need bipartisan support in this chamber if we're going to put this pandemic behind us. And we do need it today.